Module 1, Foundations of XR in Healthcare. Lesson 2. The Evolution of Virtual Sedation in Patient Care. Hello again, and welcome to our second session, where we'll delve into a fascinating and transformative application of XR technology, virtual sedation. My name is Januario Sana, and today we'll explore how virtual sedation emerged, its scientific underpinnings, and how it's redefining patient care in modern medicine. To begin, let's take a step back to understand where we've come from. Traditionally, sedation in medical settings has relied heavily on pharmacological agents. Drugs like benzodiazepines, opioids, and anesthetics have been essential tools in managing pain, anxiety, and stress during medical procedures. While effective, these drugs come with challenges. Side effects, risks of dependency, and the need for constant monitoring. Enter virtual sedation, a non-invasive, drug-free approach that uses immersive technologies like VR to distract and engage patients, effectively altering their perception of pain and anxiety. This concept didn't appear overnight, it's the result of decades of research into how the brain processes pain and how immersive experiences can modulate these perceptions. To understand how virtual sedation works, we need to touch on some neuroscience. Pain isn't just a physical sensation, it's a complex experience involving sensory, emotional, and cognitive components. The brain plays a central role in interpreting pain signals from the body, which means that by altering the brain's focus, we can change how pain is perceived. This is where VR comes in. Immersive virtual environments engage the brain's attention so completely that they reduce the capacity to process pain signals, a phenomenon known as attentional redirection. In other words, by immersing a patient in a calming virtual world, such as a serene forest or underwater scene, we effectively trick the brain into focusing less on pain and more on the experience. Studies like those by Hoffman et al. 2000 pioneered this concept, showing that VR significantly reduces pain during burn-wound care. More recently, research published in Pain Medicine, 2021, demonstrated that VR could reduce procedural anxiety and pain in patients undergoing vascular access or endoscopic procedures. Now, let's translate this science into the clinical setting. Virtual sedation is typically administered using a VR headset, which immerses the patient in a 360-degree environment designed for relaxation and distraction. These experiences are often coupled with soothing sounds or guided meditation, further enhancing their calming effects. For example, imagine a patient undergoing a PICC, peripherally inserted central catheter placement, a procedure that can be highly stressful. Instead of traditional sedation, they wear a VR headset and find themselves floating through a peaceful ocean, watching schools of fish swim by. Their focus shifts from the procedure to the immersive scene, reducing their stress and discomfort. This approach isn't limited to vascular access. It's being used for dental procedures, labor pain management, chemotherapy sessions, and even post-operative recovery. At its core, virtual sedation empowers patients to feel more in control of their experience, fostering a sense of calm that supports better outcomes. The benefits of virtual sedation extend beyond pain and anxiety management. It's a cost-effective solution, particularly when compared to pharmacological sedation, which often requires expensive drugs, additional monitoring, and recovery time. Moreover, virtual sedation has a lower risk profile. There's no danger of adverse drug reactions, no risk of dependency, and minimal side effects, apart from the occasional reports of mild nausea from VR use, which can be managed with proper device calibration. It also aligns with a growing emphasis on patient-centered care. By providing a non-invasive, engaging alternative to traditional sedation, clinicians can offer patients greater autonomy in managing their experience. While virtual sedation holds immense promise, it's not without challenges. One of the primary concerns is patient selection. Not all patients are suitable candidates for VR-based sedation. For instance, individuals with severe motion sickness, claustrophobia, or certain neurological conditions may not tolerate VR well. Another consideration is the availability of suitable VR content. The immersive environments must be carefully designed to cater to diverse patient needs. A generic VR experience might not work for everyone. Content should be customizable to match the patient's preferences, age, and cultural background. Lastly, there's the need for training. As clinicians, we must learn not only how to operate the technology but also how to incorporate it seamlessly into existing workflows. This requires a multidisciplinary effort, with input from nurses, physicians, psychologists, and even IT specialists. Let's look at some real-world examples. In the United Kingdom, VR-based sedation has been used successfully in pediatric hospitals, where children undergoing blood draws or MRIs are immersed in playful virtual worlds to reduce their fear and discomfort. In the United States, Cedars-Sinai Medical Center has conducted extensive research on VR for pain management, reporting significant reductions in both pain and opioid use among patients using VR. One of their studies, published in JMIR Mental Health, 2019, found that a single VR session reduced pain scores by over 24% in hospitalized patients, a result comparable to some pharmacological interventions. As we look to the future, virtual sedation is poised to become an integral part of patient care. Advances in technology, such as the integration of artificial intelligence, will make VR experiences even more adaptive and personalized. Imagine a system that monitors a patient's heart rate and adjusts the VR environment in real time to maximize relaxation. Furthermore, as devices become more affordable and portable, we'll likely see virtual sedation expand beyond hospitals into outpatient clinics, dental practices, and even home care settings. Virtual sedation represents a paradigm shift in how we think about pain and anxiety management. By harnessing the power of immersive technology, we're moving toward a future where patients experience less discomfort, less reliance on drugs, and more personalized care. As clinicians, it's our role to embrace this innovation, understand its applications, and advocate for its thoughtful integration into practice. By doing so, we can transform not only how we treat our patients but also how we empower them to take an active role in their care. Thank you for joining me for this session. In our next lesson, we'll explore how XR is enhancing clinical workflows and helping healthcare professionals deliver better care. See you then.